Research shows that pelvic floor dysfunction affects 1/3 of US women. This doesn't mean women that have just given birth. This means women of all ages. So regardless if you're a coach, regardless of how old your clients are, and you might notice if you're working with clients in their 60s and 70s, they're having trouble with this more. Excuse me. And you can still help them. There is help for them. So now, this is a question that a lot of women have to me. If I didn't have a vaginal birth, why am I having issues with pelvic floor dysfunction? So there is this, I'm not really sure where it stems from. I don't know if doctors are actually telling women this. I'm not sure if women are just assuming this. I'm not really sure what it is. But people think that if they have not had some type of vaginal, like trauma, like basically that's trauma to the vagina, that they shouldn't have any pelvic floor dysfunction. So I'll briefly describe why it is actually, anyone can actually experience this, even men. So, there are men that have pelvic floor dysfunction. There's actually, if you're in Maryland, in Columbia, there is a physical therapy office that has, they treat specifically pelvic floor issues, and they have a men's section and they have a women's section. That's all they treat. So this is something that men experience too, and I'm sure there isn't a whole lot of talk about that as much. I don't really hear about it as much, but that is something to know. So even if you haven't had a baby, this is something you can experience. So, but for our purposes, working with postpartum women, if you have been pregnant or if your client has been pregnant, I don't have a pelvis model, but you have all these muscles surrounding the pelvis and then holding the pelvis together like a sling. So it's almost like a basket. So this is what you want to think about. Now, when we're pregnant, that baby, however, even if it's a couple of pounds, like just think when you have a full bladder, how much that's like, how uncomfortable it is on your body. If you have a couple of pound baby, that's putting pressure on your pelvic floor muscles, and you have lots of muscles there. It's not just one big muscle. You have lots of muscles, and then they integrate with other muscles surrounding your core, your legs. I mean, they're all connected. So we have all of these muscles, and as the baby's growing, it's bearing down even more, putting more pressure. And what can happen is, those muscles become lengthened, okay? So, it's not an issue. The issue lies is if they've become really lengthened, and then after we've had the baby, we don't get those muscles to return to their previous muscle tone. So they become lengthened, they can become just really weak. Think about, excuse me, this is any muscle you can think about in your body. If you're sitting, I know some of you who are coaches, if you have clients that sit a lot, they have, I like to call it glute amnesia, where their glutes are just not working properly because they sit so much, and those glute muscles are lengthened a lot, so they're not firing properly. So this is something to consider. So these muscles are not firing properly, or some muscles can become too tight. So it's not just one or the other. It can be different reasons why you're having pelvic floor, or why your client's having pelvic floor dysfunction. So that is one. So pregnancy, just as a fact of nature, your muscles are stressed. So that is one thing to consider. Another thing to consider is, like I talked about yesterday, scar the incision. So we're cutting deep, especially if you're getting that horizontal cut. Hold on a second. If you're getting that horizontal incision, those muscles are being cut deep into the pelvis. And again, you can check out my video from yesterday, but the surrounding areas are going to be affected. So if let's go like this. If your incision's here, anything from top or bottom is going to be affected. So if the incision is really, like the scarring is very, very, very tense, then the other parts, we'll talk specifically below. So the other parts below that incision that go into the pelvis, those areas have to make up for the loss of movement in the incision site. So that is one thing to consider. So some women might feel so much better. They might feel like they can control their bladder better when they have some scar tissue mobilized. So that's again why it's super important to at least consider working on your scar after it's completely healed, or seeing someone. I definitely see someone professional, because they're going to mobilize it in a way that you can't. If you are, if you're further down the road postpartum, like years postpartum, it can be a little painful. I mean, there is tissue there that they're trying to mobilize, that tissue that has been there for years. So it can be a little bit painful, but it's one of those things that once that is mobilized better, you may feel like you can regain control of your core and your pelvic floor once again. And that is another thing. When your core canister is not communicating with your pelvis properly, then we can have issues with the with pelvic floor dysfunction. Another thing that can contribute is if you have diastasis. Diastasis doesn't matter if you've had what kind of birth you've had. That is something that can develop with pregnancy, and if you cannot heal it properly, or if you are trying to heal diastasis. So diastasis, if you don't know, is the separation, just really quick, just separation of the abdominal muscles so I like to think of it here as you are growing a baby. That linea alba that connects the two muscle bellies stretches out a bit. If you cannot heal that postpartum, or if you're in the process of healing it postpartum, and you're doing heavy lifting, for instance, you're not getting great core stability. So what happens is, if you're not getting good core stability, and I talked about this a couple of weeks ago in one of my posts. So if you want good core stability here, if you can't get good core stability, and you're doing different exercises, you're doing plyometric jumps, whatever, your pelvic floor is going to take a beating. And if that's not taking a beating, then it's going to be your knees, it's going to be your ankles. So the next place that can create stability is going to try to create stability, which can be very, very stressful on the body.